and hospitals can do for them. Now that was a stunning statement, because at that time, and physicians my age will remember at that time, and probably it's still true now, we were trained that there's an onslaught of diseases out there, a wave, a tsunami of illnesses, a tsunami of disease, and we as physicians were there to hold back that tsunami. And just come and get us, because we're there for you, and we're going to stop the tidal wave. It never really occurred to us that the health of our patients was going to be determined more by what they're willing to do for themselves rather than what we could do for them. Sure, we paid attention to preventive medicine, but not literally. It wasn't iconic. We knew that preventive medicine was important, but we didn't really get it. I mean, I was still smoking in my pediatric office in the examining rooms, and so were my partners. People were overweight, we were eating junk food, and we still didn't pay much attention to seatbelts. So we really didn't, preventive medicine really wasn't a big deal. So at any rate, what I did when I heard about Califano's dictum is I asked my office staff to do a survey on my patients, to do an economic survey. And I was shocked, because what we found was that 20% of my patients, 20% of our clinic's patients, were responsible for 80% of our revenue. 20% of our patients were coming in 80% of the time to see their pediatricians. So, you know, that didn't seem that impressive at that time, because I thought, well, this must be the diabetics and the juvenile rheumatoid arthritics and the kids with leukemia, children with autoimmune disease. But what was shocking then was to find out that the 20% of kids who were sick 80% of the time wasn't the diabetics and the leukemics and the kids with juvenile rheumatoid arthritis. They were the kids who were coming in day after day, week after week, month after month with repeated colds, snotty noses, runny eyes, swollen glands, sore throats, coughs, croup, belly aches, growing pains, rashes, and a whole host of other niggling little conditions that we couldn't even diagnose. But there was nothing really wrong with them. These were normal kids. Sure, we did some immunological testing on them, we did some allergy testing on them, but by and large, the 20% of the kids who were sick 80% of the time, it became apparent to us that these were a special group of kids, a special group of families, and we began calling them the worried well and the walking wounded. So what we did is we identified these kids and the families. It was easy to identify. These were the families who were visiting and calling the office all the time. These were the mothers who would bring in Susie, and we'd treat Susie. We'd give Susie a shot for her sore throat, which could have been strep. And mom would then say to us, well, I'm sure we'll be back in 2 weeks with Susie when she gets sick again. And Susie, of course, would hear this. Or we'd treat Johnny's earache, and mother would say the same thing. Well, Dr. Taub, I know, thank you for treating the earache, but we'll be back, I know, real soon, because we're helping pay your rent around here. Or kids with colic. The mothers would come in, and we'd try to do something with the colicky babies. Mostly we used to give them little phenobarb and hyoscine drops. But the mothers would say, look, I know this colic is never, ever going to stop. Or what else was going on? We had so many families with mothers from stressed out families who, if we didn't treat the children with antibiotics, the mothers would literally plead with us saying, look, I can't go home and tell Robert's father that we're spending $8 on an office visit and you're not giving me a prescription. So, doctor, I need the prescription. So these were people who began depending on us. And as physicians, I'm not embarrassed, because everyone was doing it and we didn't know better, but essentially We were promoting that. That's what we had learned. We didn't know anything else. So what we saw on the other 80% of the kids are coming in just 20% of the time. First of all, we hardly ever saw these families. When we did see them, it looked like they had no time for illness. They didn't want to be ill. They didn't want to be sick. They didn't want antibiotics. We had to chase them to come in for their well child checks. And when these kids were sick, the parents, instead of saying, oh, you poor dear, we're going to take you home, we're going to feed you ice cream for 3 or 4 days, and maybe next week you can go back to school. Instead, these were the families who would say to their kids right in front of me, okay, now you're going to get well and you're going back to school in 48 hours and let's stop fooling around here. So basically, it looked at that time that illness and wellness had a lot to do with attitude. This was a surprise at that time, as self-evident as it is now. So what my partners and I did is we chose 2,000 children, infants and children, toddlers, teenagers, and we decided that we would do a clinical study with them. And over 2 years, what we did is we taught these children and their families to meditate. We taught them to eat more fresh fruits and veggies. We taught them about the importance of communication, the importance of exercise, the importance of not smoking or at least smoking outside, the importance of reading to their kids, the importance of praying every night with their kids, that old one, God, now I lay me down to sleep. You know that one. And we taught them the importance about hugging their kids and assuring their kids that they would be all right. Basically, it was basic stress management 101. In terms of meditation, it was so simple. Child would come in with a tummy ache, let's say even a 4 or 5 year old child, little girl, and I would say, Janie, can you imagine a little white light that's so beautiful and pure? And Janie would say, sure. And Janie would be lying down on the table, and I'd put my hand on Janie's tummy, and I'd say, Jamie, I want you to close your eyes, and I want you to just imagine that this beautiful little warm white light is in your tummy. Can you do that? And Janie would nod her head, and I say, now, Janie, I want you to imagine that this beautiful little warm white light is just growing all through your tummy. And it's growing stronger and stronger, and it's warm, and it's beautiful, and it's healing, and it's fixing you right up. And Janie would open her eyes and say, Dr. Ed, my tummy ache's gone. Or we would do the same thing with Johnny coming in with an earache, or Susie coming in with a sore throat. We just haven't put that white light on the sore throat and in the earache. And lo and behold, the pain would diminish, if not go away, and they required much less medication. So we taught them meditation. Not only the children, but the families, a real quick one, just like that. Close your eyes, put that white light where it's hurting. We also taught the kids and their families a whole new ethic. We taught them that their health was primarily determined by their own personal responsibility and self-value and reverence for life. And it was like, you know, MDs, especially pediatricians with kids, will look like as MD is equivalent to minor deity. So here we are, 5 minor deities, and we're saying to the children, look, and the parents, you follow our advice, and we know you're going to be much, much better, and you're not going to be sick as often. You're not going to be wetting the bed as much. Your growing pains are going to get better. You're not going to have so many tummy aches. And lo and behold, it began working. And in addition to that, we also saw how amazing it was that even infants were becoming ill as a reflection of stress. And what I mean by that is it dawned on the 5 of us as we were having a conference one day in the office, it dawned on us that we were seeing babies who were actually getting gas in order for them to get colic, in order for them to get attention. It became apparent that one of the reasons why poor behavior persists in children is because it's rewarded. And the reward can often be negative attention. So whether it's kids who have, at that time, had behavioral problems, they were getting a lot of negative attention, but to them it was attention. And we were also seeing it with infants. The infants would actually get gas or they could get colic so that they had the attention of their parents. And boy, did they have a lot of attention all through the night. So what I developed at that time, we called the Taub cocktail because it was proprietary to me. The mother and the father would come in and I have a consultation with them, trying to keep them awake because most of the time they were up all night. And I'd say, look, when Emily gets her colic next time, what I want you to do is I want you to make a cocktail. And they said, fine, what's the cocktail? And I said, well, I want you to make a cocktail of 1/3 lemon juice and 1/3 honey and 1/3 Jack Daniels. And they said, Dr. Taub, Jack Daniels for Emily? And I said, no, you drink that. And wow, did that help the colic get better. So, at any rate, what happened in the 2 years was remarkable because we nearly decimated our practice. 80% of our revenues coming from 20% of the worried well and walking wounded, and we were keeping them well. What we did, so I asked the nurses to start calling the patients because I thought, well, maybe they just switched over to another pediatrician because they didn't want to meditate, they didn't want to exercise, communicate, and do all of the things that we were talking about. Maybe they thought we were nuts. But then what was really amazing is we began calling the patients, the mothers, it became apparent that they literally lost the cognition of their children having been sick because we would say, well, how's Robert? And they would say, well, why are you calling? What do you mean, how's Robert? And we say, well, he used to have all the sore throats and the earaches. And they said, and the mother would say, oh, yeah, that's right. No, he's fine. And we'd say, well, we call Susie's mother. Well, how's Susie? She said, why are you calling? And we said, well, you know, Susie used to have the growing pains and the rashes and the snotty noses and the runny eyes. And they said, oh, yeah, right, Susie did have that. So this was a pattern. We began calling people, and what was so amazing is that the parents began losing the conscious recognition and memory of what was going on with their children. So it looked like wellness, as opposed to illness, was so much tied into attitude that the word got around Orange County, particularly with other pediatricians, because we were starting to take patients away. And we expanded with another 2 pediatricians, and I brought in a couple of psychologists and trained nurses by this time. And we were then, or I was invited to speak at Grand Rounds at Children's Hospital of Orange County, in a joint Grand Round sponsored by UCI, the medical school, and Children's Hospital. And I said to myself, well, now what am I going to be telling all of my peers? I was very nervous, I was very confused. Actually, I was a little nervous and confused coming here tonight too, because here I am back after 1979 and I'm talking to all of my peers and mentors, and even Dr. Clayman, the dean of the medical school, and talking about meditation and white light and all of this. Well, back in 1979, while trying to figure out what to do with my Grand Rounds, I decided I would pay a visit to Dr. Jonas Salk down at his Salk Institute in La Jolla. And the reason I thought about Dr. Salk is because you may not know it, but he was a marvelous Renaissance individual. He was so well-read and so brilliant. He was married to Paloma Picasso, very cultured individual and very bright, and a maverick, because he went ahead and developed a dead vaccine for polio when everybody ridiculed him for decades, saying, what are you doing wasting time and money on a dead vaccine that can't work? But of course he persisted. So I took 400 charts, put them in a couple of boxes, and I labeled it Worried Well and Walking Wounded. I went down to see Dr. Salk. He had the beautiful institute there. It was overlooking the Pacific Ocean, and he had a huge conference table in front of him. It was the first time we met, and I spread 200 of those charts in front of him, and he took his glasses off and he started going through the charts. And after about 2 hours, he took his glasses off and he looked up at me and he said, "Dr. Taub, do you realize what you're doing here?" And I said, "Well, I think we're helping people get well." And he said, "Well, Dr. Taub, what you're doing is you're developing a wellness vaccination." And I said, "Well, what do you mean, like a shot?" And he said, "No, no, no." He said, "This is a wellness vaccination without shots, without pills, and it works because it dissipates stress." And he said, "And the sooner that you vaccinate people, the younger they are, the more it's going to work because," and then he looked at me again, with lots of focus. He says, "Because," and you're going to have trouble realizing this, Dr. Taub. He said, "The reason it's going to work and why it's so important is because illness begins in the mind." And I said, "Well, Dr. Salk, you don't mean all illness begins in the mind?" And he said, "Dr. Taub, it may take you a few decades to come to the conclusion, but illness begins in the mind." So, at any rate, after that wonderfully inspiring session with Dr. Salk, I prepared my grand rounds for UCI, for Children's Hospital of Orange County. And I still began wondering, well, what was I going to say? So I had a dream one night. This was 2 days before my grand rounds here. 2 days before. And you're going to find this very difficult to believe, but the dream was like a vision. And about 3 o'clock in the morning, what I saw in my vision was a beautiful blue sky, and against that blue sky was, do you remember those of you who have seen Star Wars, you know the block writing that they had, Star Wars, the golden writing? Well, what I saw in my vision was integrative medicine coming out of the sky, out of the clouds, in those golden block letters. Amazing vision. And when I woke up in the morning, I went back to sleep, I woke up in the morning, I thought, integrative medicine, what a neat idea, what a fabulous thing to call what we've been doing. And I said, well, what would that mean? So I sat down and I grabbed the closest thing I had to me to write on, and I wrote for about 3 hours. And I wrote about what I began understanding was the energy of our body and mind and spirit, and how balancing the body, mind, and spirit could activate healthier thoughts that could help us be well. So I wrote and I wrote and I wrote, and this is what I wrote. And believe it or not, this then was the beginning of integrative medicine. And the part that really beggars belief is the fact that it's on the back of a Ralph's bag. And what I wrote here was integrative medicine, and up here it says, harmonious energies activating loving thought habits. That's an acronym for health. And up here it says CHOC, St. Joe's, UCI, April 7, 1979, Grand Rounds. And basically there are 3 circles here. There's a circle about responsibility, a circle about reverence for life, and a circle about modern medicine. And then when I began filling in the circles here, on the circle about modern medicine, I filled in surgery, immunization, public health laws, psychotherapy, technological aids, diagnosis, treatment methods. And then the next circle here under responsibility, I talked about all the things that we were advising patients to take care of. Temperature in their home, air and lighting, how to express themselves, safety, turning down the television, healthier nutrition, recreation or recreation, I wrote down. And basically under this circle it talked about wisdom and the development of disease. And this circle here, reverence for life, at the top of the circle I have at one-ment, and the bottom of the